All right. Sorry. Hello, coders. Good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome back to our CPT Guideline Mastery session with AMCI. How are you all doing? Let me know. How do I sound? Am I audible? Okay, thank you, Miss Mills, for letting me know. All right, so I hope everyone doing great. All of you are doing good. Let me know in the chat. How are you doing? And we are back after a short break. So for those who have joined us again, welcome back. And for anyone, I can see a lot of new members in our YouTube channel. So anyone who have joined new, I'm glad you are here. Okay, I'm really happy. So I hope you all are feeling energized, motivated, and ready to sharpen those coding skills again today. Here at AMCI, we don't just go through the guidelines, we break them down, we simplify them, and we make them in a way you truly understand the logic behind them. Because confident coders don't memorize, they master the concepts. And here at AMCI, we help you master the concepts. Okay, so without wasting much time, let's go ahead and begin today's session because I have some great topics for discussion today. Okay, I can see everyone. Hi Akram, hi Imani, hi everyone, welcome. Hi Yvonne. All right, hi Miss Veena. I can see a lot of people are joining in. First, let's read the copyright. CPT Copyright 2026 American Medical Association. All rights reserved. CPC is a registered trademark of AAPC. AAPC content found within this presentation is a copyright of AAPC. The keyword concept FTR, Chun, AMCI, Fab 7, AMCI, ICD 10, Flip, TAP, and MCG are the trademark of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials. The credentials CCA, CCS, CCH, CCSP, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. All right, so today we are going to focus on two important topics. Yes, two important areas in the integumentary section. I'm talking about the Mohs micrographic surgery as well as the destruction procedure coding. Yes, so we will start with the Mohs micrographic surgery, understand how it works and how it's coded, and then we will move on to the destruction coding as well. All right, so these are important topics. If you're attending your board exam, they are very important for a board exam as well. So let's go ahead, let's review them. Okay, so before we begin, let's first understand where to find today's codes in your CPT manual. So you will find these codes in the integumentary system section in your CPT manual, specifically under the subsection destructions. Okay, so both most micrographic surgery and all the destruction coding can be found under the destruction uh, subsection, and the code series ranges from 1700 to 17999. Okay, so give me a moment. All right. So have you heard about most micrographic surgery before you started doing the coding? I haven't heard. It was the first time when I heard about most micrographic surgery when I was preparing for my board exam. So most micrographic surgery is a specialized technique that is used to treat the skin cancer, and especially when these tumors are complex and or otherwise if the borders are ill-defined or ill-defined skin cancer. Now, you might ask me what is ill-defined borders. An ill-defined border is one where you cannot clearly see the edges, or You don't see or you don't know where the cancer ends and the normal skin begins. All right. So skin cancers, I would say they are like icebergs, and what you see on the surface, that's just a small portion. There are often more spread underneath that you cannot see with your naked eye, right? And that is exactly where a Mohs micrographic surgery or Mohs surgery becomes more valuable in these cases. So let's compare a Mohs surgery with a standard excision procedure. So in a standard excision procedure, the physician will be removing the visible tumor along with a wide margin of surrounding healthy tissue, right? Yes, you can see in the screen, the presentation, the surgeon will be just marking the margins, and the margin includes your normal healthy tissue and the cancerous skin cells as well, right? And then they will be excised and removed. So there is a there's a big possibility that not all or not entire tumor or the skin cancer will be removed. Sometimes a small portion may be left behind, right? And the specimen, once removed, is sent to the lab, and patient usually waits for days for the result. Also, a standard excision does not evaluate 100% of the surgical margin histologically. They only remove the tumor and send a small portion of that skin cancer to the for the histopathologic examination. So we can't say there's 100% surgical uh, margin histological evaluation. So, most surgery works very differently in such cases because everything in most surgery happens in a real time. Yes. So, in a most surgery, the physician will take two roles. The physician will act as a surgeon who removes a tumor or the skin cancer, as well as a pathologist. So first, I will demonstrate the different steps in a Mohs micrographic surgery. You can see them. First, the physician will remove the visible tumor, and that would be the first step. But instead of stopping here, the tissue is carefully mapped and then it is divided into smaller sections. And these smaller sections are known as blocks. Okay, so that's very important to know. These smaller sections are known as block, and they are processed for micrographic or microscopic examination. And each block is examined by the same physician who performed the surgical excision of the skin cancer. So if a cancer cells are still seen, surgeon will remove another layer of the tissue only from the exact area where the cancer remains. Yes. So this process of examination, removal, examination, this continues until the tissue margins are completely clear of the cancer cell. And that's what makes Mohs surgery so special. It allows a histopathological examination of 100% of the surgical margin instead of just taking a small sample of the edges. The entire margin will be evaluated in such cases. So this helps to ensure that the tumor is completely removed at the same time preserving as much as healthy tissue as possible. All right. Are we good so far, coders? Let me know in the chat. Are we good? Okay. So this is what actually happens in a Mohs micrographic surgery. And each time the surgeon removes tissues and divides it into blocks to examine it under the microscope, that is considered to be as a stage. Yes. So one cycle where the physician or the surgeon will remove the tissue, and he will divide into subsections, which is known as blocks, and put it in the stain and examine under the microscope. So that cycle will be known as stage one. So if the physician decides to do it again, the next step will be, or the next cycle will be known as stage two. So it is very important to know what a stage is, and a block is while coding for the Mohs micrographic surgery. All right, so you will get to know about them in the upcoming slides. Okay, I can see few goods. Yes, okay, thank you for letting me know, and let's move on. So in most micrographic surgery, as I said, provides histological examination of 100% of the surgical margin. It is designed to maximize the tissue conservation while ensuring complete tumor removal. Also, it is commonly used for high risk or cosmetically sensitive areas. Okay, now as I previously said, another important rule of most micrographic surgery is the integration of the role. So to report a Morse code, same physician must act as both the surgeon and a pathologist. Okay, so it will be the same physician who will doing the surgery, that is the tumor removal, as well as the pathologist, the one who examines under the microscope. And an important coding rule to remember is that you cannot report a Mohs micrographic surgery codes if the surgical removal is performed by one provider and the histopathology is performed by a different physician or a lab. So in such scenarios, you have to report them separately. You cannot code from the Mohs surgery section. Okay. And this is an overview of what happens during the procedure. The tumor is removed initially in the first step, and that it will be divided into small pieces, and each piece is placed into tissue block. And as per the CPT guideline, tissue block in most surgery is defined as individual tissue piece embedded in a mounting medium for sectioning. Okay, and once the microscopic examination is done and physician determines that additional sample has to be taken, and additional stages is performed, and this process will continue until the slides comes clear of the cancer cells. Okay, great. So let's move ahead and let's look into some of the guidelines regarding the most micrographic surgery. So the first guideline says that So the first guideline says that most codes only include, or most surgery codes only cover the removal and microscopic examination of the tissue. They do not include the closure of the wound. So if a site repairs is performed, or if a site require a repair, flap, or skin grafting, you must report them separately. All right. And if a biopsy, next guideline is that if a biopsy of a suspected skin cancer is performed on the same day as Mohs surgery, because there was no prior pathology confirmation of the diagnosis, then you can report the diagnostic skin biopsy and the frozen section pathology with the modifier 59 in order to distinguish the subsequent definitive surgical procedure of Mohs surgery. All right. So if no prior pathology confirmation is present or exists, then you can, and the physician performs a diagnostic biopsy and a frozen section pathology, they can be coded separately. Make sure you append a 59 modifier. Okay, let's move on to the next guideline. Next guideline says that do not report 88314 in conjunction with 17311 through 17315 for the routine frozen section stain performed during the Mohs surgery. So if a routine frozen section stain is used during a Mohs surgery procedure, that is not coded separately. And CPT also have given few examples of the routine section stain that will be used. It includes your hemotoxin, eosin, and toluidine blue. All right. And if or when a non-routine histochemical stain on frozen tissue is used, then you can use the CPT code 88314 with a modifier 59. All right. So make sure if you are coding, it is for a non-routine histochemical stain on the frozen tissue. section. Okay, all right. So next, let's move on to the CPT codes for the Mohs micrographic surgery. So Mohs surgery codes are actually classified based on three key factors. Number one is your anatomic location. Number two, the stage, which is number of tissues removed. And number three is the tissue block. So as I said in the beginning, this is where you have to know what is a stage, or how many stages are removed or stages are performed, and how many blocks were used. Okay, so these codes are mainly classified based on anatomic location, stage, and number of tissue blocks used or removed. So if a procedure is performed on the head, neck, hand, or feet or genitalia, or the areas involving deeper structures such as muscle, cartilage, bone, etc., then you will use the CPT code 17311. Okay, and for each additional stage, you will use the CPT code 17312. So 17311 is for your first stage, and 17312 is for your additional stage. All right. And if a Mohs surgery is performed on the trunk, arms, or legs, you can report with CPT code 17313 for the first stage, and additional stages are reported with the CPT code 17314. An important thing to note over here is that coders, each stage include up to 5 tissue blocks. All right. So either it be the first stage or the add-on code or the additional stage, the first 5 tissue block is included into the stage code. Okay. And it applies to all these 4 CPT codes. And in case if there is more than 5 tissue blocks used, that's where the CPT code, the add-on code 17315 comes into play. So you can see the code language. It is for each additional block after the first 5 tissue block, and it can be used with any stage. Okay, it can be used with the initial first stage code, or it can be used with the add-on code, right? So 17315 is not a stage code. It is only or exclusively for each additional blocks used. And you must give an attention to this word, each additional block. So if 5 additional block is used, you can use 17315 times 5. Okay. Are we good so far? Please let me know in the chat. Are we good so far? Okay. All right. All right. And next we are good because we are moving on to do some coding exercise. Okay, and let's apply what we have learned so far. And here's your first question, coders. I will read the question. Of the following answers, which best describe the correct CPT coding for this procedure? Option A 17311, option B 17311, 17315, option C 17311, 17312, option D 17313, 17314. A 72-year-old male presents with biopsy proven basal cell carcinoma on the right nose. The dermatologist performs Mohs micrographic surgery. First stage involves removal and examination of 4 tissue blocks, but the residual tumor is identified. Second stage is performed with 3 tissue blocks, after which margins are clear. No repair is performed at this session. Of the following answers, which best describe the correct CPT coding for this procedure? And I will give you 2.5 minutes to solve this one. I hope you will finish way before the time ends. Okay, your time begins now, coders. All the best. All right. Yes. Yes. They are really quick. So Mr. Manny is saying you all are quick. And I think I accidentally revealed the answer as well. So sorry for that. So let me walk you through this first scenario. Okay. And so far I can see great answers in the chat and it's still coming up. Okay. So great job, coders. So let me walk you through this one together. All right. So first thing which we do here at AMCI is to do the inventory. Okay, and in the inventory, we have a Mohs micrographic surgery that is performed on the nose, and there was two stages, right? Stage one, where four tissue blocks were taken, and then we had stage two, where three tissue blocks were taken. Am I right? Okay, so if you have your MCG manual with you, and if you have it open right now, these guidelines help me to solve one of or to eliminate one of the answers quickly or maybe on site if you know those primary stage codes. Okay, because first FTR asks us to code according to the body area, right? Yes, code according to the body area. So looking into the options, I can see that option D is coding for 17313. And 17313 is for a Mohs micrographic surgery that is performed on the trunk, arms, legs. So cross-checking with my inventory list, I see that it's coding for a wrong anatomic location. Yes, it's coding for a wrong anatomic site. So option D has to go. Now we are left with option A, B, and C. Now I want to bring up another table. This is a table which will help me to pick the answers even without looking into the code options. I can or a CPT book. I can pick the correct answer with with the help of this table. So here first column is for the stage, right? So number of stages used or number of stages performed. And the second column, you can see it is for, so let me highlight. So second column over here, it's for the number of blocks that was used. And then we have a third column, which is for stage code, and a fourth column that is for number of additional blocks used. So we all know that the first five blocks is included in the stage code. And if there is any additional blocks used other than the first five blocks, you will note it over here. Okay, so we know that stage one had four tissue blocks and the stage code for the first stage would be 17311, right? 17311 is coding for a Mohs micrographic surgery of the head, neck, hand, feet, genitalia, first stage up to five tissue block. Yes. And stage two is coded with the add-on code 17312, which is for each additional stage after the first stage up to five tissue block. So the first five tissue block is included in these stage codes. And we also didn't had any blocks more than five. First stage had only four tissue block. The second stage had only three blocks. So all these blocks are included in their respective stage codes. And with that, I know that the correct answer is going to be 17311, 17312. So I didn't have to look into the other options. I knew straight away this is going to be my answer. So once now coming back to the options, I can see that option A 17311 is wrong because it is only coding for one stage. And option B 17311, 17315 is also wrong because that is also coding for only one stage, and 17315 is actually for additional blocks. It's not for a stage code. It's not a stage code. It's used for additional blocks after the first five tissue block, right? So option B is also incorrect. And as most of you have said, I didn't see any wrong answers. Everyone, most of you went with option C only, and option C is indeed the correct answer. So great coding, everyone. Okay, great coding. So how are you all doing? So let's move on. Let's move on. Let's do one more exercise. Okay, let's move on to the exercise number two. Here we go. Of the following answers, which best describe the correct CPT coding for the procedure? Option A 17311, 17312, option B 17311, 17312 times 2, option C 17311, 17312, 17315, option D 17311, 17312, 17315 times 2. A 68-year-old patient undergoes Mohs micrographic surgery for a biopsy proven basal cell carcinoma of the left ear. During the first stage, the surgeon excises the tumor and examines the two tissue blocks, but residual tumor is identified. A second stage is performed requiring three tissue blocks, followed by a third stage requiring five tissue blocks, and after which all the margins are clear, no repair is performed. During the same operative session of the following answers, which best describe the correct CPT code for this procedure. And once again, coders, you got 2.5 minutes to answer this one, and your time begins now. All right, that's almost time. How are you all doing, coders? Place your answers in the chat. Don't worry, even if you get it wrong. We are here to learn. Okay, so don't worry. Give your best answers, and we will solve this one together. Okay, so I can see a split between option B and an option C. So good, good, good. I appreciate everyone's participation. So please go ahead and let's make this one an interactive and a fun learning session. All right, so let's go ahead and let's solve this one. Great. Okay, sorry, my on clicks are off. Okay, so we will begin with the first step. Let's look into the inventory. So we have a Mohs micrographic ear surgery performed on the ear, and there were three stages, right? We had stage one, we had stage two, and stage three. And stage one had two tissue block, stage two had three tissue block, stage three had five tissue blocks. Okay, you agree with me? Are we on the same page? Let me know in the chat. Now, let's have a look into our table, our box. So as per the inventory, stage one had only two block, And the CPT code or the stage code for stage 1 would be 17311, right? Yes, it would be 17311. And stage 2 had 3 blocks. And again, the stage code for the stage 2 would be 17312 because that's an add-on code or the additional stage perform, right? So that would be 17312. And again, we had a third stage as well. And for the third stage also, the stage code would be 17312 because as I said, you have to read the code language carefully. So this 17312 is for Mohs micrographic surgery for each additional stage after the first stage. So if there is 3 stage performed, your CPT code should be 17311, 17312 times 2, right? So if there is a 4 stage performed, then it would be 17311, 17312 times 3. Okay, are you following, coders? Let me know in the chat. So here also there is no additional blocks beyond the first 5 blocks performed, right? Stage 1 had only just 2 blocks, so there is no additional blocks because first 5 tissue block is included in the CPT code 17311. And stage 2 had just 3 blocks. Again, it's not beyond the number 5, and stage 3 had just 5 blocks. Okay, so again, the additional blocks used is 0. So the correct CPT coding, I'm not looking into the option, correct CPT code should be 17311, 17312 times 2. All right, see how I'm easily able to come into the answer even without looking into those options. Okay, I can see only one person said, like, yes, you're following. How about the remaining people? I can see a lot of people are here. Let me know in the chat. How are you all doing? So option A would be incorrect. It's only coding for 2 stage. We had 3 stage. And next option, yes. And next option, D and C would be also incorrect because that is coding for the additional state block code 17315. We didn't had any additional block used in our scenario, right? All the blocks used were included in the stage codes. So option D is incorrect, option C is incorrect. And the correct CPT code is going to be option P, 17311, 17312 times 2. All right, let me quickly look into the chat. And did you had an aha moment? If you had a aha moment, please let me know. Please let me know because those are really priceless. As just now, Miss Mills also mentioned, aha moments are really priceless. And if you learn something, also let me know in that chat. All right, so let's move on to the next one. Exercise number 3. So I'm a little bit increasing the complexity or challenge. So let's move on to the third scenario. There you go. Of the following answers, which best describe the correct CPT code for coding for this procedure? Option A 17313, 17314 times 2. Option B 17313, 17314 times 2. Option 17315 times 1. Option C 17313, 17314. And option D 17313, 17314 times 2. 17315 times 2. A 60-year-old female patient with recurrent squamous cell carcinoma on the left upper arm. Most surgery is performed during the first stage. Tumor is excised and examined using 6 tissue block but the residual tumor is identified. A second stage is performed requiring 4 tissue block, followed by a third stage requiring 5 tissue block. After which all the margins are clear, no repair is performed during the session. Of the following answers, which best describe the correct CPT code for this procedure? And you got this, coders. Your time begins now. Okay, okay, okay. All right. Go ahead and let's solve this one. I can see some great answers. So people have learned from last scenario. That's what I understand. Okay. So let's go ahead and let's solve this one. So what do we have here in the inventory? We have a Mohs micrographic surgery that's performed on the arm, right? On the left upper arm. And we had three stages. We had stage one, we had stage two, and we had stage three as well. So first stage had six tissue block, stage two had four tissue block, and stage three had five tissue blocks. Now let's solve this with the help of our small box here. So as per the inventory, I've noted it. We have stage one with six tissue block, and the stage code for the first stage would be 17313, right? So 17313 is for most micrographic surgery for the trunk, arms, legs, and your arm falls over here. So first stage up to five tissue blocks. Okay, so stage one only covers up to five tissue blocks, but we did had six blocks performed in the first stage, right? So we have to give one block code over here under the additional blocks used column. Okay, so there was one additional blocks used, and stage 2 had only four tissue blocks used. So the stage code would be 17314, and those four blocks are included in the stage code. Stage 3 had five tissue blocks used, and again stage code for the third stage would be 17314. All right, so with this information, let me try to pick the code. So first code would be your primary code 17313. Then you have to code for 17314 times 2, and you had one additional block used, right? So for that, you have to code 17315 times 1. And with that, I see that the most appropriate or most matching code would be option, or the option would be option B, which is 17313, 17314 times 2, 17315 times 1. And that's what I saw in the chat as well. There was a lot of B's. So great answers. Option C is incorrect because that's only coding for two stage. Option A is also incorrect because it's missing to code the additional block codes, right? And option D, it's coding for extra additional block codes. We only had one additional block used, and the correct answer is going to be option B. Okay, someone has mentioned there is no aha moment for this scenario. Okay, because you learned it from the last scenario, right? So that's why I said keep interacting in the chat, keep putting your answers, and if you get it wrong, that's not a big deal. But if you learn something, that is always priceless. So keep learning, and let's move on to the next scenario. I have one more scenario on the Mohs surgery. Okay, so I've again increased the challenge a little bit up, so this might be a little bit more challenging. Okay, here we go. Of the following answers, which best describe the correct CPT code for this procedure? Option A, 17313, 17314 times 3, 17315 times 1. Option B, 17313, 17313 times 3, 17315 times 2. Option C, 17313, 17314 times 3, 17315 times 5. Option D, 17313, 17315 times 3. A 70-year-old patient undergoes Mohs micrographic surgery for a biopsy-proven basal cell carcinoma of the right leg. During the first stage, surgeon removes and examines 7 tissue blocks, but the residual tumor is identified. A second stage is performed requiring 4 tissue blocks, followed by a third stage requiring 5 tissue blocks. A fourth stage is necessary, during which 8 tissue block is examined, after which all the margins are cleared. No repair is performed during the same operative session. Of the following answers, which best describe the correct CPT code for this procedure? All right, coders, your 2.5 minutes has begun. I am confident you are going to nail this one. All right, Curtis, have you all placed your answers in the chat? If not, please go ahead. Please go ahead. Give your best answers. And I'm going to walk you through this one. Okay. All right. I will give you a couple more seconds. All right. All right. So let's go ahead and let's solve this one. Okay. So let's have a look into the inventory. So we had a Mohs micrographic surgery. It was performed on, I think it was performed on the right lower leg. Okay, forget what I've written over here. It was right lower leg. Okay, and we had four stages here. We had one stage where seven tissue blocks were removed, and the second stage there were four tissue blocks removed. We had a third stage that had five tissue blocks removed, and also we had a fourth stage where eight tissue blocks were removed. Okay, so there were four stages performed, and let's bring up our box, and you can see in the stage one there was seven tissue block. For the stage code for the first stage would be 17313, right? And we all know that first five or the up to five tissue blocks are included in the stage code. So excess, we have two tissue blocks, so we put it under the box for, or the column for, additional block. And in stage two we had four tissue blocks used, right? So they are inclusive in, or they are included or bundled in the stage code for 17314. So no need to code for additional block. And next we have stage 3, which had five tissue block. Again, the first five tissue block is bundled into the stage code 17314, so it's 0, no need to code for additional block. Stage 4 interestingly had eight tissue. Okay, it had eight tissue block, and the stage code would be 17314. So we have to put 3 for additional blocks used. So greater than 5, we had more than 5 tissue blocks were used. So in excess there were 3 tissue block used. So we put as 3 in the number of additional blocks used. All right, coders. So the CPT code would be 17313 17314 times 3. How, or number, how many blocks were used, how many additional blocks were used. This is where I said in the beginning, be careful or be forensic about the code language, because code language clearly states it is for 17315 is for each additional blocks after the first five tissue block any stage. So it's for each block, each additional block use. So we have two blocks here and three blocks here. So total we had five tissue blocks used, right? Five additional tissue blocks used. So the correct CPT code should be 17315 times 5. That eliminates option C, only coding for one stage. Option A, only coding for one additional blocks. Option B, it is only coding for two additional blocks. We had additional block, and the correct CPT code or correct answer is going to be 17313, 17314 times 3, and 17315 times 5. All right. What? How are you feeling, coders? Let me know in the chat. How are you feeling? Did the explanation help? Okay. Okay, I will just wait for your questions. If you have any questions, please place your questions in the chat. Okay, so someone did ask me, do we need to put quantities 1 if there is only one quantity? That's not required. Okay, I just place them in the question just for purpose of understanding. Okay, so no need to place quantity 1 if there is only one quantity used. That's fine. Okay. All right, so someone has asked for one more. How about the remaining students? Okay, did the explanation help, coders? Let me know. Please do let me know in the chat. Okay, so unfortunately we had only 4 scenarios under the Mohs micrographic surgery, and now it's time for us to move on to the next topic for the day. All right, and next topic is going to be the destruction procedure coding under the integumentary section. So this section mainly deals with the destruction of the benign, pre-malignant, and malignant lesions. Okay, and here is an important part. The destruction can be performed by different methods such as electrocautery. So what's an electrocautery? Electrocautery is done using electric current to burn and destroy the tissue. It can be also done using the cryosurgery. So in cryosurgery means extreme cold will be used, like using liquid nitrogen, for example, to freeze the lesion. And it can be also done using a laser. That is done in laser destruction. We use focused light energy. And finally, it can be also done using chemical treatment. That is by applying chemicals to destroy tissue. So if either of these techniques is used, you will code for the destruction code series under the integumentary section. Okay. And CPT code also has given some examples of the lesions that is destroyed or that can be coded under this section. They include destruction of your condylomata, papillomata, molluscum contagiosum, sorry if I'm pronouncing it wrong, hepatic lesions, warts, common and plantar and flat warts, milia, and other benign lesions as well. Also, it includes premalignant lesions such as acne keratosis, also malignant lesion. And these are reported with the code series ranging from 17000 to 17286. So if you see any destruction of these wards, you can code from this code series range. But important thing you have to keep in mind is about this guideline. For destruction of the lesion in specific anatomic sites, you have to use these site specific codes. So if your lesion is destroyed and that belongs to a particular anatomic site which is coded under these code series which is mentioned here, you have to code from that section. All right, and also be mindful about a few guidelines. There are a few parenthetical guidelines under the destruction section in your integumentary chapter, so please also have a look into these parenthetical guideline before you code them. Okay, now let's have a look into the codes for destruction of benign or premalignant lesion. So for the premalignant lesion destruction, the code series ranges from 17000 to 17004, and 17000 is for the first lesion, first premalignant lesion, and 17003 it's an add-on code for second through 14 lesion each. Again, you have to be careful about this code language. It's for each lesions. Okay, so if you had two lesions, two premalignant lesion destroyed, you will use 17000 and 17003. Okay, if you had three lesions destroyed, you have to use 17000 and 17003 times 2, because 17003 is an add-on code for each lesion second through 14 destroyed. All right, I hope that's clear. And 17004 is used for destruction of premalignant lesion, which is 15 or more lesions. So if you had 15 or more lesions you destroyed, you will use only 17004. All right, and now let's look into the next code. Next is for cutaneous vascular proliferative lesion destruction. It's coded from code series ranging from 17106 through 17108, and they are classified based on the square centimeter. All right. Yes. And next we have codes for destruction of benign or other benign lesions other than skin tag or cutaneous proliferative lesion. And the codes used is 17110, that is for the destruction of benign lesions other than skin tags or cutaneous vascular proliferative lesion up to 14 lesions, and 17111 for 15 or more lesions. And also we have code 17250, which is for chemical cauterization of granulation tissues as well. Now moving on to the destruction of malignant lesion, any method, these are the codes. So 17270. Okay, these codes also are classified based on two factors. One is the anatomical location and the lesion diameter. So Yes, if the destruction is performed of the lesion, the malignant lesion on the trunk, arms, or legs, you will use the code 17260 through 17266. And if the destruction is performed on the scalp, neck, hand, feet, or genitalia, you will use the code 17270 through 17276. And if the destruction is performed on the face, ears, eyelids, nose, lips, or mucous membrane, then you will use the code 17280 through 17286. So these codes are classified based on number one, the anatomic location, and number two, the lesion diameter. So there are not much guidelines under this section. All you have to do be a little bit forensic while coding for destruction of the lesions, and also be careful about the code language. And under the other procedure, we have specific codes for cryotherapy for acne. Then we have codes for chemical exfoliation for acne, electrolysis epilation for 30 minutes, and also we have unlisted codes. Okay, that's all about the restriction section. And let's go ahead and let's do exercise from this part. And here's your question. Of the following answer, which best describe the CPT coding for this procedure? Option A 17004, option B 17110, option C 17111, option D 17110, and 17111. A physician uses electrosurgery to destroy 16 common warts on patient hand. Of the following answers, which best describe the correct CPT coding? And I'm sure you don't need 2.5 minutes, but please go ahead and place your answers in the chat. All right, I can see a few answers in the chat. Great job, great job. Okay, let's go ahead. Let's solve this one. So these are the code options which are available for us. And here in our scenario, physician used electrosurgery, okay, electrosurgery techniques in order to destroy 16 common warts on patient's hand. So CPT code 17004 is for pre-malignant lesions. And if you look into the CPT codes, you can see it's mentioned that destruction of the common or the plantar warts, you have to use the CPT codes 17110 or 17111, right? So common or plantar warts are categorized under CPT code 17110 and 17111. So 17004 is incorrect. That's for premalignant lesion. And 17110 is also incorrect because that's coding only for up to 14 lesions. And the correct CPT code would be option C, as most of you have said. That's for destruction of the benign lesions other than skin tags or cutaneous vascular proliferative lesions up to 15 or more lesions. You don't need to code 17110 and 17111 in this scenario. Okay, so the correct answer is going to be option C. So great job. Quickly, let me move on to the next one. Right, of the following answers, which best describe the correct CPT coding for the procedure? Option A 17110, option B 54056, option C 17000, option D 17270. A male patient presents to the clinic with condyloma, benign lesion located on the penis. After evaluation, physician decides to treat the lesion using cryosurgery, which is destruction with the extreme cold. No additional procedures are performed. Of the following answers, which best describe the correct CPT coding for this procedure? And again, you have 2.5 minutes to solve this one. Right, coders, your time begins now. All right, so great answers in the chat. I thought this might be a little tricky scenario, but you all nailed it. Excellent, excellent. So if you are in your mobile version, the screen size might be small. So if you're looking in, if you're watching the stream using your system or the desktop, please move on to the desktop version so you will see a much bigger screen. Okay, let's solve this one. I think you have nailed this one. So let's see. Let's see how I solve this one. So 17000 is coding for a destruction of pre-malignant lesions. We have 17110 that's coding for destruction of benign lesion other than the skin tags and cutaneous proliferative lesions, right? And 17270 that's coding for a destruction of malignant lesions. So all these codes are good, but we do have a guideline. This is one of the guideline which I refer to beginning of this section. And the guideline stated that for a destruction of the lesion in these specific anatomic sites, you have to code from these sites. Okay, right? And if you look into the CPT code for 54056, that's coding for a destruction of the lesion of the penis, and it include the condyloma. That's what mentioned in our scenario. It was condyloma that was destroyed, and uh, electrosurgery was used, right? So 54056 also falls under those codes, right, which is mentioned in the parenthetical guideline between 54050 and 5405657. So your code 54056 exactly falls within these codes. So if a destruction of lesion is performed on the specific anatomic site, you have to code from this section and not from the integumentary section. And that makes option A wrong, option C wrong, option D wrong, and option B, the correct answer. You all are fantastic. Excellent, excellent job, coders. So it is time for the poll scenarios. Okay, so let's see what we have learned so far from today's class. Let's review them. And here's your first hand poll scenario. So this is going to be a rapid fire round. Place your answers quickly in the chat. A surgeon, the surgeon removes a tumor, but separate pathologists perform a microscopic examination of the tissue blocks. What should be coded? Whether you should code for the most micrographic surgery codes, or you should code for standard excision and pathology code, or only pathology code, or for the biopsy codes only. What say you, coders? Quickly let me know in the chat. All right, let me know in the chat. No answer so far. Quickly, coders. That's something which we reviewed today. Okay, I can see the answers are starting to come. Great. Okay, absolutely. Absolutely correct. Yes. If a separate pathologist perform the micrographic examination and excision is performed by separate physician, you have to use them separately, right? You have to use a standard excision and pathology code, because if you're going to use a most micrographic surgery, you have to follow the rule. In most micrographic surgery, the same physician who is a pathologist who performs the role of a pathologist as well as a surgeon. Okay, so good job. Yes. If either of these responsibilities is delegated to another physician or other qualified healthcare professional who reports the service separately, these codes should not be reported. Okay. Next question. After Mohs on scalp, a complex closure is performed. Which coding is correct? Mohs option A, Mohs include the repair. Option B, use repair code only. Option C, use 17311 plus a repair code. Option D, 17311 and 17315. What say you, coders? Okay, all right. So shall I reveal the answer? Go ahead, coders. Give your best answers. Okay, these are guideline specific questions. All right. Now I can see the answers coming, and the correct answer is going to be option C. Use 17311 and the repair code. Okay, so because the guidelines clearly stated that if a repair is performed during a Mohs surgery, use separate repair code or flap codes or the graft codes. All right, so the repair is not included in your Mohs surgery. They can be reported separately. So option C is going to be the correct code. That's coding for Mohs surgery as well as a repair code. Let's move on to the next one. Okay, here we go. Surgeon uses hemotoxylin an eosin stain during the Mohs stage 1. How is it coded? Add 88314, add 88331, included in 17311, or option D, add 88302. What say you coders? Go ahead, go ahead, go ahead. Place your answers in the chat. Yes, indeed. The correct answer is option C. Yes, it is included in 17311, which is your most surgery codes. Okay, because the guideline says that do not report 88314 in conjunction with 17311 through 17315 for routine frozen section stain such as hematoxylin, eosin, toluidine, blue performed during the most micrographic surgery. So these stains are commonly used and they are included or they are bundled. Okay, if non-routine frozen section stain are used, they can be coded separately. And in brackets, it's been clearly mentioned these are the routine frozen section stain that are used. Okay, so I think this is going to be the last handful scenario. Okay, which is correct. A routine non-immunostain is used during most because tumor margins are difficult to visualize. Option A, 17311, 88314 time 59 modifier. Option B, 17311, 88314. Option C, 17311. Only option D, 88314 instead of more surgery. Okay, it's similar to the previous one. I know you got this one now by this time. Okay, let's wait for the answers. If a non-routine immunostain is used during the Mohs surgery, how is it reported? Okay, maybe you have already placed the answers in the chat. It gives there is, I'm sorry, there is a small delay for answers to show up for me. Okay, and the correct answer is going to be option A. Yes, option A is going to be the correct answer because the guideline again stated that when a non-routine histochemical stain on frozen tissue is utilized, you should report 88314 with a 59 modifier. So that's the most important part, use of 59 modifier. And as the question said, this was a non-routine immunostain used, okay? And that makes option A the correct answer. So how did you do, coders? How did you do? Let me know in the chat. Did the session help you feel more confident on the Mohs surgery and distraction coding? Or you might be thinking, I might need a little more practice and guidance. That is absolutely okay. Because remember, the mastery doesn't happen in just one session. It happens with constant learning, repetition, and right support. So repetition is the key. Okay. The playback is always available for you. Take a look into it. So where can you find the playback? Coders, if you feel like you need more practice or you want to revisit these today's concepts or the previous sessions which we have taken, head over to the AMCI YouTube channel. And inside the channel, you will find a dedicated playlist. Yes, that's called CPT Guideline Mastery Session. And this playlist includes all our previous session recordings where we have broken down topics step by step in details. Okay, we had a lot of topics done so far, and I think there are 26 topics so far done. So all those topics are there in, or all those lecture videos are there inside this playlist. Go ahead, and you can review them. All right. So if you enjoyed today's session, coders, don't forget to smash that like button. Okay, I am placing the survey link in the chat as well. So if you enjoyed the session, please don't forget to smash that like button, subscribe our channel, share this with someone who needs to see this. And also, we really appreciate it if you could take a moment to fill out the survey form which I placed in the chat. Your feedback helps us to understand what's working and what can be improved and how we can serve you in a better in the future session. So if there is any topic that you need to review or if you need us to take next week, I think we will be covering the musculoskeletal system. Okay, so if you need any topic from the musculoskeletal, please let us know. You can fill that in the survey form. Okay, your survey is very, very important to us. So I truly appreciate you taking time to complete it. And thank you so much for your support. And I will see you next session. I am also placing the link of our playlist in the chat as well, so you can review them. Okay, so Curtis, once again, kindly fill out the survey form, and we will see you next week with a new topic. Okay, till then, stay safe, keep coding, and have a great weekend.
$4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all